Here's what I think we can say about the health care bill Senate Republicans released today. It takes what most people don't like about Obamacare and makes it much, much worse. You're always going to hear healthcare is complicated. It's something people say to make you turn away from it, to let them do what they want.
Nobody knew that healthcare could be so complicated.
It's not that complicated. This bill, it has a lot of moving parts, but you can really get what it does down into 140 characters. Healthcare expert Larry Levitt did it today. That is the core of this bill. That is what so many of the policies in it do. It makes healthcare more expensive for poor people. The first thing the bill does, the biggest thing it does, the main way it changes American healthcare, is it guts Medicaid. So beginning in 2021, Obamacare's Medicaid expansion begins to phase out. That Medicaid expansion was responsible for 11 of the roughly 20 million people who got covered with insurance under Obamacare. From 2021 to 2024, that expansion phases out entirely. Beginning in 2025, all that's left is Medicaid that we had before Obamacare, and then the bill takes aim at that. It moves that Medicaid onto a growth rate that doesn't keep up with how much healthcare actually costs. So year by year, Medicaid is getting cut pretty deeply against what it actually needs to spend to cover people. Now, why do you need to do all this? Why do you need to put hundreds of billions, even over time trillions of dollars in cuts to the health insurance that the poorest people in this country rely on? There's actually a reason. You can see it right here in the bill. Those couple of words, that is a huge tax cut. It is a capital gains tax cut. Capital gains is investment income. And in Obamacare, investment income on rich people got taxed a little bit more to pay for health insurance for poor people. That Obamacare tax increase is repealed. And in order to fund the repeal of it, the Republican Party needs to gut Medicaid. They need to find some way to pay for this huge tax cut to rich people. How big of a tax cut to rich people is this? A similar version of it in the House bill got looked at by the Center on Budget and Policy parties. The 400 richest families in America would get a $33 billion tax cut. That is about as much as it would cost to keep the Medicaid expansion going in 4 states that are covering 700,000 people. Back to the point about insurance that covers less. You'll see on page 41 some language about essential health benefits. This recurs at different points in the bill. What this does is it changes the very definition of what insurance has to cover in order to count as insurance under the law. One thing Obamacare did was it defined what qualified as real insurance. It had to cover things like pregnancy, like mental health, like hospitalization. The Republican bill lets states waive out of the essential health benefits clause. So you can have insurance that doesn't cover hospitalization. You can have insurance that doesn't cover pregnancy, which was very often the case, by the way, before Obamacare. This is important for a reason people don't always realize. In addition to meaning insurers can rip you off with insurance that really doesn't cover what you needed to cover, it's also a backdoor way of making it possible to discriminate against people with pre-existing conditions. If you have an expensive condition, insurance that doesn't cover anything related to that condition is not worth anything to you, and you won't sign up for it. Another really telling policy in the bill that gets at the same idea in a different way. On page 5, they change what the bill defines as, quote, an applicable median cost benchmark plan. That is obviously a beautiful turn of phrase, but what it means is that when you get subsidies under Obamacare, it is not just tied to how much money you make, it's tied to how much a good plan costs in your area. And the way the law defines a good plan is a plan that is about 70% of your expected healthcare costs. The Republican bill changes that benchmark plan. It brings it down to 58%. That is lower than the lowest plan most people can buy under Obamacare right now. What's remarkable about all of this is that Republicans actually knew what people didn't like about Obamacare. Listen to Mitch McConnell, the guy who wrote this bill, talking about Obamacare just a few months ago.
What you need to understand is that there are 25 million Americans who aren't covered now. If the idea behind Obamacare was to get everyone covered, that's one of the many failures. In addition to premiums going up, co-payments going up, deductibles going up, and many Americans who actually did get insurance when they did not have it before have really bad insurance that they have to pay for, and the deductibles are so high that it's really not worth much to them.
He's right. Those were the problems with Obamacare. The bill didn't cover enough people. It did have too high deductibles. It did have too much cost sharing. It did mean people ended up sometimes buying insurance they couldn't use because it cost them too much to use it. He understood that people were angry about it. They wanted something better, and he promised them that he would give them something better, and then he has created a bill that is going to make every single one of those problems worse.
We'd love to have some Democrat support, but they're obstructionists. They'll never support. We won't get one, no matter how good it is, but we will hopefully get something done, and it'll be something with heart and very meaningful.